The article Working with Trauma, 3 Points of View helped me to expand my understanding of trauma through showing them that it's not only experienced by the patient, but also by those who take care of them, like their family and healthcare workers. For me, one of the key takeaways is that trauma is not just a psychological experience, but it is also a physiological response that the body remembers, which may explain why patients may continue to experience distress even after an event has passed. By better understanding these things, it will help to form my future nursing practice and how I view patient care, or rather healing, as something that isn't only treating physical symptoms, but also recognizing how trauma affects the mind, body, and spirit. Another important thing that the article highlights is how nurses are at risk for vicarious trauma due to constant exposure to patient suffering, but it also provides another perspective through vicarious resilience, where caregivers can find meaning and strength through their work. I think this is especially important because it reminds us that being present, regulated, and compassionate not just helps our patients heal, but also protects us nurses and other caregivers from burnout, allowing us to grow through those challenges that we face in practice.
Backing off of Kira, what stood out to me about the reading was that trauma doesn't just affect the patient, but it also affects the people caring for them. And the concept of like...
That's okay, you can come through. Don't worry.
Sorry.
No, that's alright.
The concept of like trauma made me realize how, as a future nurse, I could be impacted by what my patients go through. Nurses are often the ones that are closest to the patients during their most vulnerable moments, and it's really easy for us to carry some of that emotional weight without realizing it. I also found the readings that was really important was like trauma living in a body is really meaningful. It made me think about how patients might react in ways that don't always make sense, such as like being anxious, shut down, or overly reactive. Instead of like viewing that as like difficult behavior, this reading helped me understand it as like a protective response. And I think that shift in perspective feels really important for me to provide more compassionate care. This reading also made me reflect on how important self-care is in nursing. If I am constantly exposed to trauma, I need to be aware of how it's affecting me so I don't become overwhelmed or burned out. Even something as staying grounded or taking a moment to reset myself could make a difference, not just for me, but for also my patients.
Yeah. My main takeaway from Working with Trauma, 3 Points of View is that trauma affects individuals in complex ways, and effective care requires understanding the person's emotional, psychological, and social experiences. The reading emphasized the importance of empathy, active listening, and creating a safe environment where individuals feel supported. It also showed that different professionals may approach trauma from different perspectives, but collaboration and compassion are essential for providing holistic care. This reinforced the idea that trauma-informed care is not just about treating symptoms, but about recognizing the past experiences that influence behavior, coping, and health outcomes. And from David Ronald's article on advanced directives of end-of-life care, my takeaway is that cultural beliefs, trust in healthcare system, and personal values strongly influence decisions about end-of-life care. The perspective shared in the article highlighted how historical experiences and cultural background can shape attitudes towards medical decisions like advanced directives. It reminded me that healthcare providers must respect cultural differences and communicate clearly and respectfully when discussing sensitive topics like death and dying. Overall, these readings taught me the importance of providing patient-centered care that is compassionate, culturally sensitive, and respectful to each other's experiences and beliefs. As a future nurse, this means taking time to listen, building trust, and recognizing emotional and cultural factors play a significant role in healthcare decisions.
Yeah, jumping off what they all said, after reading the article Working with Trauma and 3 Points of View, I learned that vicarious trauma occurs with health caregivers, therapists, or nurses. We're all affected when we're kind of getting that repeated exposure to other people's suffering, and it can lead us to have anxiety, any emotional numbness, and any loss of like trust or safety within ourselves or with our patients.
That's okay.
You just want to
No, that's okay. That's okay, Theo. We're almost done.
Sorry.
That's all right.
And then also trauma is not just psychological, but it's also stored in the body, and how the nervous system kind of reacts to automatically perceived threats. which is why people may experience more trauma or different trauma responses. Because of this, healing requires body-based practices like grounding, breathing, and learning to regulate the nervous system, which we as nurses can help our patients with. The article also introduces resilience, which highlights how caregivers can experience positive growth through their work by witnessing other people's strengths and recovery with their patients. This increases hope, self-awareness, and any sense of purpose, showing that trauma work is both challenging but also transformative. And then from a nursing perspective, this is especially relevant because nurses are frequently exposed to trauma within our patients. And then understanding how the risks of vicarious trauma and the potential for resilience can help nurses prioritize self-care while also finding their meaning in work.
Yeah, and then jumping off of that, I said that the trauma article explains that trauma should be understood from a psychological, social, and spiritual perspective. And it's not just about symptoms, it affects identity, relationships, and meaning. So care needs to be holistic and focus on listening, safety, and emotional and spiritual support. The second reading highlights how end-of-life decisions are shaped by culture, and factors like mistrust, strong family involvement, and faith in God influence choices, including preferences for life-prolonging care. Overall, both readings emphasize that as healthcare providers, we need to be culturally sensitive, build trust, and respect each patient's beliefs when providing care.
What stood out to me from the trauma reading was how important perspective is. The 3 points of view really show that trauma isn't just about what happened to someone, but also how they experience it and how we respond as caregivers. It made me realize that I need to be more aware of my own reactions and biases, because even small things like tone or body language can either build trust or make someone feel unsafe. From the article on advanced directives, I thought it was really powerful to see end of life through a cultural lens. Ronald David's perspective highlighted how historical mistrust in the healthcare system can impact decisions. It reminded me that having conversations about end of life care isn't just about medical facts. It's about listening, respecting values, and understanding where someone is coming from. Overall, these readings reinforced for me that being a good nurse isn't just about clinical skills, but about empathy, cultural awareness, and creating a sense of safety for patients.
I agree with that. I think that it was important to take into account with the first article that everyone experiences trauma in different ways, and their care isn't just like a linear type of care. We have to take into consideration what works for them and what can help them heal. And with the second article, I like how he talked about his perspective and how the healthcare system impacted him. I think it's important that we have to take into account that we have to take into account the vulnerability that each patient faces, and